Today I will discuss few aspects of Glycopyrronium, which is a versatile drug having anticholinergic activity. The objective of this session are to understand what is glycopyrrolate or glycopyrronium and how it is commercially available in the form of tosylate or bromide, and what are its characteristics that make it a unique drug for various uses. Now, glycopyrrolate is a quaternary ammonium derivative which belongs to antimuscarinic anticholinergic drugs. Commercially available drug is a racemate and its the derivative glycopyrronium tosylate and glycopyrronium bromide are available. Now, glycopyrronium tosylate is a topical agent available as a skin wipe, whereas glycopyrronium bromide is available as a tablet, oral solution, or parenteral injection. This agent does not easily cross blood-brain barrier because it is a quaternary ionized or polar compound, but its duration is much longer than previously existing drugs such as atropine and tiotropium. Let us discuss something about its pharmacological actions. The drug glycopyrronium is antimuscarinic that competitively and reversibly blocks muscarinic receptors, muscarinic 1, 2, 3, 4, and 5 receptors in various organs. We all know that most of the muscarinic 3 receptors are present on smooth muscles in bronchi, GIT, and blood vessels, whereas muscarinic 1 receptors are mostly neuronic, muscarinic 2 receptors are mostly cardiac. But the agent is known to be rather more selective over muscarinic 3 than other receptors. Now, because it blocks the muscarinic 3 receptors in airways, it counteracts the bronchoconstriction and is available as inhaled agent to reduce tracheobronchial secretions and to cause bronchodilation in chronic obstructive lung disease and add-on therapy for bronchial asthma. Blockade of the gastric muscarinic receptors reduce the volume and acidity of gastric juice, which is useful in certain conditions, and compared to atropine, it is less likely to cause tachycardia because cardiac M2 receptors are blocked, but to a lesser extent. And it has greater anti-secretory actions because M3 receptors are blocked to a greater extent. Being quaternary, as I told you earlier, it usually does not penetrate blood-brain barriers. Therefore, CNS anticholinergic effects are not seen. However, in very high doses and toxic doses, nervousness, drowsiness, and lightheadedness. So far as pharmacokinetics of this agent are concerned, it varies according to the route of administration. Mostly, the drug is currently available as inhalational and oral solution or parenteral solution due for anesthesia. Obviously, when it is given IV, its bioavailability will be almost complete or 100%, whereas oral bioavailability is variable and inhalational bioavailability is roughly about 50%, that is 40% to 56%. It achieves the peak concentration Cmax in the time orally given 3 hours, parenterally within minutes, whereas topical within 1 hour and inhalational within 20 minutes. And its volume of distribution is about 1 to 4 liters, and that is explained by the fact that drug is polar, quaternary ionized derivative and doesn't dissolve in the lipid membrane, so it remains in the vascular fluid compartment. Protein binding varies from 30 to 44% and mostly bound to albumin and alpha globulin. The agent is metabolized by CYP2D6. First it is oxidized and then it is hydrolyzed, and there may be some role of cholinesterase enzymes. Drug is primarily eliminated metabolites through kidney and has a half-life of about 3 hours when given orally, but it is certainly less when given by other routes. It is to be noted that inhalational route provides very long half-life. That means drug is there bound with the receptors in the tracheobronchial tree and is gradually dissociates to appear in the blood, and therefore it shows that the drug is a longer acting by inhalational route. And this point is important for its therapeutic utility. Obviously, it has to be. Now, among the other dosage forms which I already discussed, so now we can understand tablets, oral solution, parenteral injection, intramuscular, intravenous, and topical solutions are available. Now, therapeutic uses of this agent are varied, and most important is use in anesthesia as perioperative agent. The purpose of anesthetic medication is to reduce airway and salivary secretion, to prevent reflex bronchospasm occurring during intubation and induction of anesthesia, to decrease volume and acidity of gastric juice, to avoid inhalation and regurgitation, and to inhibit cardiac reflex, that is vagal reflex, and that usually causes slowing bradycardia that may predispose to arrhythmias, and they commonly occur during induction of the anesthesia. And during anesthesia, once surgery is begun, some doses may be required to inhibit surgical process induced or anesthetic drug induced arrhythmias which occur intra. Now, another important indication of glycopyrronium is axillary hyperhidrosis. Now, this condition occurs in many persons. About 3 to 10% have been the incidence, and there is no apparent reason, but there could be the autonomic dysfunction. Now, hyperhidrosis is quite embarrassing and disproves the quality of life, and therefore it requires treatment. Not many drugs are available. Currently, topical wipes have been marketed in the name of Obrexa elsewhere, not in India, and these are tablets which are bound in individual pouches. Now, each wipe has a 2.4% glycopyrrolate tosylate solution, which is pre-moistened, and in terms of quantity, it contains about 105 milligram of tosylate, which is equivalent to 66 milligram of the glycopyrrolate active agent. Now, the method of application must be understood. One wipe is to be swiped on one armpit and then on the other. That means for two armpits, two axillae, we will require one wipe only, and this is to be done once in daily and not repeated. Therefore, one wipe for two armpits in a day, and that can be utilized for a period of 2 weeks. Now, since it contains active agent that can be topically absorbed from hand, so it is said that hands should be washed or some gloves should be used beforehand. Now, alternately, studies have shown that 1% cream, which contains about 540 milligram of glycopyrrolate, can be used on each armpit, and that is reported to be having a good antiperspirant activity in short term. Long-term studies are underway with the 1%. Now, glycopyrrolate have been used in the treatment of peptic ulcer, particularly duodenal ulcer, with variable results. When it was indicated, that was a time when other potent agents, anti-secretory drugs, were not available. Now, later on, it was realized that although it decreases acidity acid secretion and volume of secretion. To some extent, there are limitations, and the limitations are very high doses needed that usually produces systemic adverse effects, although CNS adverse effects are less likely with polar compounds. Anticholinergics, when used in ulcer, they prevent sweating and heat regulation. Therefore, they impair the adjustments in the hot environment during summer days in tropical countries. And the drug affects gastric emptying because it has antispasmodic activity. So greater gastric retention time is increased, and that will cause greater acid retention and acid digestion. And it also relaxes the lower esophageal sphincter that promotes the reflux of the acid contents, and therefore this have grave limitations that preclude the use of antimuscarinic anticholinergics in peptic ulcer, and so is for glycopyrrolate. And currently, highly potent beta drugs are available which are in use, H2 receptor blockers and proton pump. Now, like other drugs, this agent also has adverse drug reactions, short-term and long-term. Now, mostly anticholinergic adverse drug reactions are peripheral in nature because drug does not penetrate blood-brain barrier adequately. Dry mouth, constipation, tachycardia, blurred vision, cycloplegia, which may precipitate glaucoma in elderly, photophobia, dry skin, and burning sensation in eyes, and flushing, particularly in alcoholics. Now, it reduces ability to sweat, so temperature dysregulation may be seen in hot environment. It may lead to hyperthermia. Central ADRs are usually less, but in toxic doses, drug may cause delirium. And such drugs, antimuscarinic, anticholinergic drugs, should be used with extreme caution in elderly, in persons with hyperthyroidism, in persons with ulcerative colitis. Patients on antidepressants and antipsychotics or other drugs which have antimuscarinic actions per se will exhibit greater unwanted antimuscarinic actions as ADRs, and there could be precipitation of glaucoma or retention of urine in elderly patients. The drug is contraindicated if there is acute angle closure glaucoma, obstructive uropathy, hiatus hernia, GERD, and allergy to ingredients. So, points would be a drug which is a quaternary ammonium derivative, has peripheral actions, quick onset and long duration of bronchodilatory action, is used in a number of conditions, and these are pre and intra-anesthetic purpose, along with neostigmine and myasthenia to counteract the muscarinic actions of neostigmine, and along with neostigmine to counteract the overdose toxicity of skeletal muscle relaxants, and this avoids cardiac slowing and appearance of the pain abdomen, sweating. Other important indication is the topical inhalation in the treatment of COPD and bronchial asthma, which can be used as an additional bronchodilator in the form of LABA. A LABA can be combined with this agent, and this agent itself is a LAMA, that is a long-acting antimuscarinic agent. Axillary hyperhidrosis, orofacial hyperhidrosis have also been an indication, although it is an off-label use of this drug, and for this purpose people use it 0.5% to 2% solution over the face. Cyalloria in children with cerebral palsy, anti-secretory agent in duodenal ulcer, and antispasmodic agent for pain abdomen or irritable bowel syndrome, occasionally as tablet. So these are the summary indications of glycopyrrolate, and you will realize it is a versatile. So those who want to know more about this agent can go through this reference. Very much for patient hearing.